Hello, this is a video tutorial uh, uh, introducing some basic SEMA functionalities. So in this tutorial, I will show you how to construct a hypothesis and how to test it in SEMA and how to visualize the the results in the plot window. So SEMA is a hypothesis building and testing tool, and currently features datasets from 26 adult cancers in TCGA, all the way from bladder carcinoma to uterine carcinoma, and 5 pediatric cancers from the target consortium. So if you haven't done so already, I would advise that you go through the tutorial PDF on the website, where it details all um, the use of different functionalities, their purpose, and it also gives some nice detailed step-by-step introduction into some of the more advanced tools, such as exploratory modeling, and factor analysis and heat map analysis. So here I will only show you how to build a basic hypothesis and how to test it. Um, so first, to build a hypothesis, we need to add variants of interest. So let's say we are interested in how p53 mutations affect cell cycle progression and overall survival in different cancers. So for that, I come here, so I choose somatic mutations, type in p53, choose p53 here from the suggestions, add. So now I have the p53 mutation node in my hypothesis. It's not connected to anything else, so there's no hypothesis yet. We only have p53 mutations here. But for now, I can also visualize the data for p53 mutations in all these different data sets by just clicking on plot selection. So now it shows the mutation frequency, uh, the and also wild type patient numbers in the selected data sets here. So I can look at it in bladder, breast, cervical carcinoma, colon, and every time the plot here changes. Or I can look at them collectively. So change the y-axis options to proportion. Let's say remove the wild type here, so because I'm only interested in the mutation. So now this plot is showing the mutation frequencies of p53 in all the different cancers. So to test the effect of p53 mutations on cell cycle progression, so I will choose RNA expression of a cell cycle marker, let's say Ki67. So Ki67 is a common marker that is used both in IHC and also elsewhere for measuring cell cycle progression and mitotic index in tumors. So I will check mRNA expression here, and I will type in MKI67, which is a gene for Ki67, add. So now I have two nodes in my hypothesis. I can also visualize the expression level of Ki67 across all the different cancers, and it's going to show me the box plots. I can make it log scale, overlay the individual data points, and so on and so forth. I can also add or remove some of the tumors that I'm not interested in from here, or also from here. Okay, now let's make a hypothesis. To make a hypothesis, all we do is draw a causal line from p53 mutations to Ki67 by dragging a line from p53 mutation node to the Ki67 RNA node. So now we have a hypothesis. It's a simple hypothesis that p53 mutations affect MKI67 RNA level, and it can be tested very easily by clicking on Evaluate. So once the evaluation is complete, the results are going to be overlaid on the graph. So here we see that the color for the link has changed, and the thickness will also indicate the size of the effect from the regression analysis. So currently, the overlay is showing the average, the size effect of average across all the cancers here. So we may be interested in, let's say, specifically in bladder cancers. So you'll notice that the thickness and and probably the effect size changes. So to visualize that, we can overlay the individual statistics that are associated with each link. So currently we only have one link, but if we have more links, each link is going to be overlaid with the individual statistics. So let's say we're interested in the p-value, and we see that this p-value is highly significant. How p53 mutations affect the Ki67 levels in bladder cancers. Again, we can see average, and the average is not so much, but individually, um, we can also make it z-value or the standardized regression, or again p-value is quite significant. So we can also visualize this across cancers. So you just click on the link, plot selection. So currently it only shows raw data. When you say raw data for a link, it just shows in this case the expression levels of Ki67 stratified by p53 mutations in colon, in esophageal carcinomas, in GBM. Of course, you have to plot selection. So, but we can also look at several of them here. Uh, um, at the same time, but we can also visualize the statistics associated with each link. So in this case, let's look at z-scores. So z-scores are basically the effect size of beta regression divided by the standard deviation. So it directly reflects the p-value of association. So the from the normal distribution. So z-score of 2 and -2 is associated with a p-value of 0.05 roughly. So you would be looking at things that are above or below these 2 points. Positive means positive effect of p53 mutations on the Ki67. Negative means negative effect. So in head and neck cancers, p53 mutations actually reduce Ki67 RNA level, and in the most of the rest of the cancers, as you would expect, p53 mutations predict higher Ki67 levels, and hence probably higher cell cycle progression. We can also view p-values. So this is negative log 10, so this is obviously quite significant. So 2 would be associated with a 0.01 p-value. So that was a basic hypothesis, and now we can complicate this by adding, let's say, clinical variates, let's say overall survival, to the model. And now let's see how p53 mutations also affect overall survival. In fact, let's see how Ki67 also affects overall survival. So now this is now a complex model. Here p53 mutations affect Ki67. Ki67 affects overall survival. P53, and we're also testing how p53 mutations affect overall survival independent of Ki67 by this direct link. Let's evaluate that. Now when we evaluate that, so this is showing for breast cancer, we can look at bladder, but in every case, at least in these two cases, the p53 mutation, direct effect of p53 mutations on the overall survival is not that great. But let's see that across all the different cancers by plotting this selection. Across all the different cancers. So now we see that effect of p53 mutations on overall survival, the direct effect that is independent of the Ki67 is quite significant in at least a couple of cancers. But let's see how Ki67 affects overall survival. We just click on this link and then plot selection. And as you'd expect, tumors with higher cell cycle progression are expected to be quite aggressive, and as such, Ki67 levels predict worse survival in most cases. You can also visualize that, let's say individually let's look at it in kidney papillary carcinomas. Where is it? And then visualize the raw data, which in terms of when it has to do with overall survival, it will show you Kaplan-Meier survival curve. So here, Kaplan-Meier survival curve of kidney papillary carcinomas stratified by the expression levels of Ki67. So here the percentile cutoff is at 50%. So the cutoff is at the median, so high and low. So high Ki67 predicts worse survival. We can also change the cutoff. So in every case, in fact, if you go higher, the separation is going to be even higher. So meaning that Ki67 expression really does correlate with worse prognosis in kidney papillary carcinomas. Um, so that was a basic demonstration of how to build and how to test hypotheses in SEMA, and how to visualize and interpret the statistical results. And again, so this can be complicated arbitrarily. So you can add, let's say, copy number variations. Let's say CDKN2A copy number variations. CDKN2A loss is a very common event in cancers, as you can also see from this plot. Um, it's quite common, and we can also see individual effects of p53 mutations versus CDKN2A loss on overall survival, and plot the selection. And then now here you see how deep loss of CDKN2A correlates with worse prognosis. This is in kidney papillary carcinomas, but AML, that was ovarian, lung squamous carcinomas, lung adenocarcinomas. This is in low-grade gliomas. You can see the difference is pretty dramatic, and then we will see the same also in the z-scores. Very significant. It's negative 6. Yeah, low-grade gliomas are quite significantly associated with worse prognosis when CDKN2A um, is hemizygously lost. So this was a basic demonstration of how to build and test hypotheses in SEMA. In the future videos, I will show some more functionalities such as exploratory analysis, heat maps, and factor analysis.